Today out here on the grounds of the VA, we have a combination of events we're hosting. Part of it is training. We have approximately 120 or so people from hospitals throughout the Bluegrass over in one of the large buildings practicing evacuation of patients down stairways. Also out here on the grounds, we've collected a large assortment of the major medical disaster assets that we have within the region that we keep spread throughout the Bluegrass, and we've brought most of the major assets here so that all of our partners can learn how they work, see what they'll look like, just in case these assets ever come up into their facility. And this is a partnership with the Kentucky Department of Public Health. One of the reasons we started planning for this event, it actually started last summer in the aftermath of the Joplin tornadoes. Since we primarily deal with hospitals and EMS units, we took a hard look at some of the lessons learned from Joplin and decided we should probably structure some training on how to evacuate hospitals that have been severely damaged when you don't have power and elevators. So that was the initial impetus to set this up. Many of the assets that are out here today did in fact deploy to West Liberty. So if, hopefully it would never happen in our region, but if it does, the 17 counties that make up our region, we're planning and working together. If we ever had a large-scale weather event, it's probably going to be more to handle than just, those of us in public safety. That's why the Red Cross is here, volunteer organizations to help us recover. So I think it's important for citizens to understand we do have mechanisms in place. We do train, and we are prepared for that event that hopefully will never happen. And the Masterson Station scenario is really more the kind of scenario we worry about. If we do have a destructive storm or tornado drop into one of our residential areas, these are the sorts of assets that we'll likely deploy out there to help provide medical care and transport injured people to regional hospitals. Believe it or not, we have more damage from very destructive thunderstorms annually than we do on tornadoes, but also severe winter weather. We're quite concerned about that. Collapsed trees, power lines. If we had sustained losses of power during an ice storm, for example, it impacted a nursing home or a healthcare facility, we would have the ability to roll in, maintain medical care and treatment without power, with our field capabilities up until the point where potentially we'd have to evacuate. But we have the ability to continue to maintain people, take care of them, and if we have to, we'll transfer them out using these assets. Many of our assets also are cross-trained in hazmat and chemical types of responses, at least as it relates to treatment of medical casualties, primarily because of our involvement with the Bluegrass Army Depot in Madison County and Richmond. So every year, all the Fayette hospitals and hospitals in most of the central Kentucky region practice, for example, a chemical weapons accident, which is very similar to if you had, say, a tanker truck overturn on the interstate with a hazardous chemical. The same processes and training and response pretty much apply. So we're fortunate in that we also have a pretty high level of training to deal with chemical or industrial sorts of accidents by virtue of our training with the Bluegrass Army Depot.
The American Red Cross helps people in need of disasters like fires, floods, tornadoes. We are a non-governmental agency that works closely with governmental partners. All of our funding, though, comes from the public donations. This is a great opportunity for all of the community agencies who would play a role in hospital evacuation or disasters to come together and get the training before a disaster occurs. Because once a disaster occurs, that's not the time to be learning the skills that you need. You need to practice so it's at the back of your mind. You know what to do beforehand. The Red Cross is out here for Spring Fury. We're participating with our government partners by serving food out of our ERV, which is our emergency response vehicle. We're always looking for people to come and volunteer with the Red Cross. We have a variety of ways that people can volunteer, whether it's through our health and safety department or disaster services. We've got everything from sitting at the front desk to deploying to places like West Liberty, Missouri, wherever there may be a need. We just appreciate all of the support that the community gives us, and we look forward to working with more folks.
I'm always interested in training, so I'll take this knowledge back to my office, to my deputy coroners. We probably won't be involved in trying to help transport living individuals, but always in disasters or every day of my work, we're transporting deceased individuals from multi-floor facilities, apartment buildings, sometimes nursing homes, people who have died, and we're looking to be able to do that at an easier way, a safer way, and we're looking at equipment that we can purchase to utilize in helping us to do that in a safe and safe manner for us that are actually transporting the individuals, as well as making sure that we can transport the decedents in a safe manner as well. One of the biggest things that I've seen in past trainings is you can learn about the experience of what you're being trained for, but one of the most important reasons is to network with different agencies that are participating in the exercise today. There's going to be a number of different counties. Most of them are going to be here in Central Kentucky. So I'll maybe learn different people that I might be able to go and help in their community. They might be able to come and help in our community. And obviously with Flight 5191, with that tragic death of 49 individuals, we utilized a lot of different agencies from a lot of different counties. And in training for disasters in the past, it was very comforting to me to know and see these individuals as they were showing up to 5191's event there at the airport. So learning who, where they are, what they do, the equipment they have is one of the biggest important part of this training exercise for me. We work 24 hours a day, 7 days a week, weekends, holidays. I presently have 6 deputies. I'm down a deputy right now. So there's 8 of us that actually go out on scene and pronounce people dead. My responsibility to our community through the statutes of the government, through the KRS, is to actually pronounce people dead, establish the cause and manner of death. And we not only provide that service to Fayette County, but there's a number of individuals that are actually brought to Fayette County for health care reasons. A lot of people who have been injured are brought to the University of Kentucky Medical Center as a level 1 trauma treatment center. Those individuals die there. So our caseload is not just Fayette County. It can be accidents and shootings and things that have happened around Fayette County. Those individuals are brought here, and when they die, it's the coroner's responsibility to investigate any unnatural death. And we do investigate a lot of natural deaths as well.